So congratulations on your Quickshot presentation. And I just wanted to start with telling the group just a little bit, a brief synopsis of your paper.
Yes, absolutely. So we looked at the daily insulin requirement of 58 non-diabetic burn patients, and we looked at the intervals from 0, 24, 48, 72, and 96 hours prior to the collection of blood for sepsis. And we found that the daily insulin requirement began to increase at 48 hours compared to the baseline, which was 96 hours.
And so how did you come up with this idea, or what got you interested in pursuing this?
So I actually did not come up with this idea. One of the co-authors, Ms. Jenna Kessie, she is a nurse practitioner at the burn unit here, and she's worked with us for quite some time. And she's the one who formulated this idea. And I, as an eager med student, I wanted to get involved with research. So I reached out to Dr. Disnike. She's the chair of our chair of the surgery department at our institution, and she connected me with Ms. Jenna Kessie.
Well, that's fantastic. Well, even more congratulations to you as a medical student being able to present your research at the AAST. That's fantastic. So what finding would surprise people the most from your research?
I think it would be the fact that what we found that the changes in vital signs and hematologic parameters were not significantly different in relation to the baseline. That was surprising to me, and I think to most people. Okay.
And then what's the takeaway for people as they read your study or listen to your presentation?
I hope that people can, after reading the study, they can use the results to conduct further research on non-diabetic burn patients and conduct further studies that could look at the sensitivity, specificity, the predictive indices, and the utility of insulin requirement as an indicator for sepsis in the burn patient population.
And so do you see this changing your practice, or how should it change anybody else's practice with your study?
So I think just relying on vital signs and hematologic parameters is not enough. And there are a lot of criteria for this, but adding the daily insulin requirement to the diagnostic process would be helpful.
Okay. And what plans do you have, if any, for a follow-up study or two on your research?
Yes, so the next step is we're going to be looking at the daily insulin requirement at the same time intervals, but after the collection of blood for sepsis. So we looked at 96 hours before, and now we're going to look at 96 hours after.
Okay, well, great. We look forward. Okay, great. We look forward to seeing that research as well. And is this your first time presenting at AAST?
Yes, it is.
All right, fantastic. And why did you submit to AAST?
We submitted to AAST because, well, it's the leading organization for the field of trauma and also for surgically ill patients. So that's why we picked AAST.
All right. Well, we're glad you did. And once again, congratulations on your research and your presentation.
Thank you. I'm happy for the opportunity.
All right.